Hello and welcome to Basic Spanish for OT, PT, and SLP clinicians. My name is Juanita and I will be your host. I am an occupational therapy assistant as well as the author of this book, Basic Spanish for OT, PT, and SLP clinicians in the acute hospital setting. This book, as well as the ebook, can be purchased on Amazon.com. I will leave a link on the channel. On today's video, we will continue with basic questions and commands from page 97. We are moving along, page 97 in the book. If you have the book, I will encourage you to turn to that page now and we will begin. If you don't have the book, let me kind of encourage you. Get a copy of the book. It will make following along in these series of videos that much easier. You'll be able to not only hear what I'm saying, you'll be able to see what I'm saying. There are videos on here that I actually have done, what I call them my bonus videos, where I'm just doing videos that's not related to the book, but it's related to Spanish. But you can still follow along, but it will make it that much easier for you to follow along. Also, I just want to take this time. I don't do this on every video, but please hit the like button if you like these series of videos, and as well as the subscribe button if you want to get notification when the videos upload. And lastly, tell a friend. This video was done for the therapists or the clinicians at my the hospital, the acute hospital setting in which I work in, as well as I am a clinical instructor at the college that I actually graduated from. But these series of videos can be helpful to so many people. When I tell many people about them, I've had so much good feedback saying, man, I really am so glad that you did this, because as much as I encourage you to use a certified medical interpreter when you are working with your patients, unfortunately, in the days and times that we're in, that is not always available. Some people have it. I'm fortunate, I'm blessed at our job that we have wonderful certified medical interpreters. So I normally don't even have to even use Spanish. But sometimes there are simple things that you want to be able to say really quick. That you're like, I'm not really sure if I'm going to call the interpreter to ask them, do they want a soda, or what do they want to drink, or something simple. So again, that's why this book and this channel is Basic Spanish. You'll notice, as I've said before, I did not put anything, and there won't be anything on this channel that requires signed consent. Anything that's in depth will not be on this channel. And I did that purposely because, again, for those situations, you must use a certified medical interpreter. Okay, with that being said, vamos a empezar. Let's get started, okay? So on page 97, the first thing that we're looking to tell somebody here is, I will help you so you don't fall. So what I used here is, te ayudaré para que no te caigas. So I'm going to say that again. Te ayudaré para que no te caigas. I'll say it again. Te ayudaré para que no te caigas. So that is, I will help you so you don't fall. That's giving our patient some encouragement, okay? The next one, I will help you to stand up. Te ayudaré a ponerte de pie. Te ayudaré a ponerte de pie. One last time. Te ayudaré a ponerte de pie. So I constantly keep looking at the book because there's different ways that you can say things. So I want to be consistent with what I wrote in the book. So let's move on to the next one. I'm going to leave that in the video because that happens all the time. Normally I would stop and then start over again. I'm going to leave that in there, okay? So the next one is, I will put your catheter on the walker while we walk. So again, this is the acute hospital setting. So in the setting that I'm in, often patients will have Foley catheters or condom caths. They will have them in place, and we're getting them up to stand up and either walk or even just stand. You want to assure them. You don't want those things pulling off or pulling out. You definitely don't want that to happen. So you want to assure the patient that you're acknowledging that that is there. So, pondré tu catéter en el andador mientras caminamos. I'm going to say it again as I put it in the book. Pondré tu catéter en el andador mientras caminamos. One last time. Pondré tu catéter en el andador mientras caminamos. Okay? And that is, I will put the catheter on the walker while we walk. The next one, I will talk to the nurse. Hablaré con la enfermera o el enfermero. Hablaré con la enfermera o el enfermero. So I will speak to the nurse. The last time I'll say it. Hablaré con la enfermera o el enfermero. The next one on this page, if I am not here, another therapist will see you. So in the setting in which I'm at, it's a very large hospital. We don't carry generally caseloads where you're seeing the same person every day. I can see one person today and possibly maybe not see that person again for quite some time. And I connect with my patients. So sometimes one of the questions they will ask is, will I see you tomorrow? And I want to be able to say to them, no, you may not see me, but you will see someone. Someone will be here if I'm not here. So to say that, si no estoy aquí, otra terapeuta te verá. Si no estoy aquí, otra terapeuta te verá. Last time. Si no estoy aquí, otra terapeuta te verá. Okay? The next two questions, is it daytime? And you would say that, ¿es de día? ¿Es de día? ¿Es de día? Or if you want to ask them, is it nighttime? ¿Es de noche? ¿Es de noche? ¿Es de noche? So it may seem strange, why would you ask a patient that question? But again, for those of us that are in the acute hospital setting, one of the things that can happen is people can get delirious, and delirium can set in. So one of the things, it's very important, we have some protocols. You want to make sure that the patient is aware of their daytime versus their nighttime. Are they cognitively intact? If they look outside the window, and I will actually show you outside the window. So you see that it's light outside. I'll turn this. You see it's light. It's light. So one of the things that I would ask a patient is, ¿es de día o es de noche? Based on the way it looks outside, you can tell from this that it's not nighttime, it's the daytime. So I'm at 9 minutes and 30 seconds. I'm a little bit close. So one of the things I suggest is try to watch the videos over and over again. Listen, learn, and repeat. That's how we learn. Just listen, or I should say listen, practice, and repeat. And that is where the learning comes from. So, gracias por venir, and I will see you in the next video. I just made it.